weird because as doctors, we see everything, right? I've seen literally the inside of people's butts and the outside of people's butts. I don't know which is worse. Hi frenemas, it's me, Dr. Jake, YouTube's loudest and proudest physician. Let's watch some Scrubs.
As a first-year intern, you have very little free time.
Isn't that the truth? I would often get only one day off every week, and sometimes that day would be on a Wednesday.
So when you finally have a night off, it's important that you do something constructive with it.
It's a bar called the Free Clinic. I love that. Ours in Cleveland was called the Fairmount, but this sounds good too. I just probably wouldn't make my bar for medical people medical themed.
How's it going? I'm
JD, I know. Yeah, he won't stop talking about you. I'm Jennifer.
Jennifer.
Do you really spend every day saving children's lives?
When I tell people that I'm a doctor, I do get that question a fair amount, but usually I don't want to answer it because I don't always save lives. Sometimes those lives slip away, so it's a rough question for me to have to answer. The excitement that non-medical people have about my job is fascinating to me.
I was laughing so hard, milk was coming out of my nose.
Well, I was tripped over an IV and blood shot over everyone.
Yeah, doctor stories often don't go well. I don't know if you saw when I reacted to Steven Universe with a lay lesbian, but when I mentioned diarrhea, she kind of freaked out.
Don't worry about it, man. I feel good tonight, you know what I'm saying? Good. Except for this stabbing pain in my side.
So he was up all night with a high fever, cramping and crying.
Dude!
Getting sick as a doctor is the worst thing ever because I will tell you, most doctors hate going to the doctor. It's just a thing.
All right, showtime. Clear out so I can check him out.
Whoa. You're examining me? I don't want you to see my unmentionables.
I've seen underwear before.
Actually, I use the word unmentionables for my genitals as well.
It's weird because as doctors, we see everything, right? I've seen literally the inside of people's butts and the outside of people's butts. I don't know which is worse. But I still have trouble when somebody else wants to examine me feeling weird about it. I shouldn't. I know what's happening.
Shortness of breath, dizziness, problems urinating.
No. Is it a problem if it whistles?
Oh, you're making this so much easier. Are you sexually active?
Oh, it's active.
If you're asking a patient about sexual activity, just saying, "Are you sexually active?" is a terrible way to get a straight answer, or a gay answer, whatever kind of answer you want. It's a bad way to get an accurate answer. Focus on activities, like when's the last time you had oral sex, or anal sex, or vaginal sex? People, surprisingly, have different definitions of what sex is, so you have to be pretty specific when you're talking to a patient about it.
Oh, just give us a second, will you, big guy? Did you hear about her? The other day...
Watching Dr. Cox, I realized we never really stop craving the attention of people we look up to.
Medicine actually is that kind of rat race, especially in an academic setting where every single promotion you get is based on being able to impress your boss again and again and again. But there's always someone higher. So at some point, you gotta stop and say, what am I doing? Why do I care this much?
Our next patient is a 26-year-old male who has presented vomiting, abdominal cramps, and fever.
I guess I never realized how hard rounds are on the patient.
In a teaching hospital, these kinds of rounds are reasonably commonplace. Everyone gathers around the bed and they talk about you in the third person. And it kind of sucks. It's impersonal, and I know that medical students and residents have to learn, but I think there's a better way that doesn't make patients feel ogled. And if you haven't yet, please subscribe to my channel, like this video, and hit the bell so you get notified whenever I have a new upload.
Say he has a simple case of appendicitis.
Turf him to surgery. Moving on.
So a TERF is when you take a patient who has a condition that your service doesn't treat and send them to another service. So for example, internal medicine cannot treat appendicitis. We don't do surgery, so that patient has to go to surgery. That being said, it's not quite that simple, and many times patients will stay on the medicine service and then just have their surgical problem managed by surgery. Kind of depends on the hospital. But a TERF is a not so nice way of putting it.
I get to cut you open. I get to cut you open. I get to cut you open. Go, girl. Go get it. And go. And down. And down.
I'm dying. I mean, this is kind of what I would want in the hospital, but I know it's literally not what anyone else would want.
BP 60 over pound. Is he having a heart attack?
No, it's hypotension. An electrical alternance on the monitor. This is tamponade. Viral infections can cause pericarditis.
Cardiac tamponade is when you have fluid around your heart. That fluid obstructs the muscle, sort of like pushing it in, and makes it so that you can't pump blood correctly. And electrical alternans is just a pattern on an EKG where the electricity alternates being high and low. It's a very specific sign for tamponade. Tamponade like this that's causing low blood pressure, though, is an absolute emergency and needs to be drained with a needle immediately. I don't know that any internist would do that, though, but maybe at other hospitals they would. Certainly not at mine. We would call somebody to help with that.
Pericarditis and a rapid accumulation of fluid. It looks like a heart attack, but don't let it fool you.
Oh, BP stabilizing.
It really doesn't look like a heart attack. A heart attack can present with a low blood pressure or hypotension, but usually a heart attack will just present with chest pain.
I think you're right. I just don't know how to connect with patients.
You can start by touching them, you know, holding their hand or stroking their hair or giving them a reassuring pat on the arm.
What are you doing?
Okay, I think Carla's wrong about this one. I think not all patients appreciate touch. In fact, some patients really don't want to be touched, and the physical exam is a huge burden for them. You can be warm towards a patient without stroking their hair. I think Elliott being perceived as cold is kind of sexist. She's doing the same thing probably that her male colleagues are, but being perceived a different way. I don't love this advice.
Fever spiking. They're worried that your appendix might burst, so we're going into surgery now.
Who's on call tonight?
Dr. Turk, let's get started.
If one of my friends who's a doctor were treating me, I'd actually feel very relieved because your friends are gonna take care of you. If it's one of your friends who's a doctor, they're gonna take extra precautions to make sure that nothing goes wrong because honestly, if something happened to one of my friends that I was treating, I'd feel terrible.
Most doctors don't believe in the whole out-of-body experience thing. And I don't know if it was real or a dream, but I swear...
That intubation tube that's in his mouth, there's no way that would ever be like that. They would secure it to his face so that it doesn't get pulled out. In almost all surgeries, you'll have a breathing tube placed that goes all the way into your trachea, which is the tube that connects your voice box to your lungs. But the fact that tube is coming out of the side of his mouth is kind of a miss, because that means that there's almost no way that could make it down to the trachea. Those things are typically shaped like that, so it's gonna like get caught in the back of his throat. That's kind of gross. And also, you don't want a patient's mouth in the same realm as your sterile field. The patient has to be under the sterile drapes so they won't contaminate the wound. That's why all the surgeons wear masks.
Seriously, man, I want you to know if I ever need surgery again, I want you inside of me.
I want to be the one inside of you.
That's a little bit gay.
I just want you to know how serious I am about what I do.
Did you stitch your initials into me?
That would get you fired and possibly also get your medical license revoked. So don't do that.
Now you can have ginger ale and a cracker.
Yeah, I don't think they let him out of the hospital just to go to a bar. But I like the idea. This is why people hate hospitals. Let the people drink. Unless they're there for an alcohol-related disease like liver failure.
Dr. Cox. If you want, you can come down here and hang out with...
Nobody talk. Just drink.
This is a cute scene, but I have to say that there is a huge problem with alcohol abuse and substance abuse in medicine. It's a hard job, and that leads people to drink and use drugs sometimes. I guess I just hope that that doesn't happen to Dr. Cox. Thanks for watching. If there's another episode of Scrubs you want me to react to, please let me know in the comments. And if you haven't seen it, here's a link to my first Scrubs reaction. Thanks for watching, and I'll see you in the next one. Bye-bye.